Margolis, and I'm the founder and president of Center for Inspired Teaching, an education nonprofit based in Washington, D.C. At Inspired Teaching, we believe every child and teacher should love coming to school. Since our founding in 1995, we have taught thousands of teachers and school leaders to build their practice in engagement-based education. Through intensive in-person fellowships and an array of digital programs and resources, we help create classrooms where students solve complex problems, collaborate, and pursue continuous learning and growth. Today, we're talking about school connectedness. The CDC recently released the Youth Risk Behavior Survey Data Summary and Trends Report, offering a close look at the mental health crisis affecting our country's young people. According to the report, the percentage of students across every racial and ethnic group who felt persistently sad or hopeless has increased. Reports like this can feel paralyzing in their scope, but there was one facet of the study that really grabbed our attention. In looking for causes of that depression, the CDC asked respondents about their relationships. Of those surveyed for the study, nearly 40% of high school students reported that they did not feel close to anyone at school. The report noted that this is an area where schools can really make a difference. The CDC defines school connectedness as when students feel that adults and peers in school care about their learning as well as about them as individuals. This includes a sense of being cared for, being supported, and belonging at school. The report concludes that school connectedness has a long-lasting protective impact for adolescents well into adulthood on almost all the behaviors and experiences included in the report. So we've been shining a light on what can be done to ensure all students feel connected at school. Today, I'm joined by Dr. Sarah Ash Coombs, an attending physician in the emergency department at Children's National Hospital in Washington, D.C. She's going to share her unique perspective on both the challenge and opportunity before us. Welcome, Dr. Coombs.
Thanks for having me.
Your work brings you into contact with children at the crisis end of mental health. How are you seeing the concerns of the CDC report play out in your context?
Yeah, so as you mentioned, I am a pediatric emergency room doctor. So basically, I work on the front lines. I'm based here in Washington, D.C. at our Children's National Hospital. And at Children's National, we have both medical and psychiatric patients who come through our emergency room. So we see all of them. I would say that the CDC report was stark, but was not surprising to me. And I don't think will be surprising probably to teachers and people in the education field, and certainly to any of us who work clinically with children, with teenagers, with pediatric patients. What we've seen is just ever increasing numbers of children coming, seeking actual emergency care because of how far on the spectrum they are into crisis with a mental health concern. So we see depression, we see anxiety, and we definitely, unfortunately, see suicidality. Anywhere from children who are having thoughts around suicide to children who've actually made an attempt or come up with a plan to make an attempt. So, as you can imagine, it's tough. It's very hard on both the children. It's hard on their caregivers, whether that's a parent or another person in the family or a close friend. It really affects kind of a whole unit of people. And yeah, we see, unfortunately, many, many children on a daily basis seeking emergent care for mental health concerns.
So you're really seeing these statistics. They're not statistics. They're real people.
Right.
In your work. So of course you strive to heal the children that you come into contact with. So I wanted to take a minute to ask you about what that entails. I heard a recent interview with the U.S. Surgeon General, Vivek Murthy, in which he said, "To me, healing is about making whole. And to be a healer, you have to be able to listen, to learn, and to love." Does that resonate with your experience?
It does. It definitely does. I love that you brought up that quote. I was recently at a narrative medicine conference in New York City, and we we touched on that quote as well. It came up for us. And I think it's very well said. And I think it brings up a few things in medicine, especially in an emergency department environment. Often the pace is very quick. You know, we're seeing a lot of patients. We're trying to see patients as quickly yet safely as we can, because we know, excuse me, there are time pressures that people are trying to come seek care and then hopefully get back home. But I think what we've learned and seen is that really listening is so important in medicine. And, you know, in this segment, we're really focusing on mental health, but I will say, even from a physical health perspective, you know, one thing that we've shown over and over again in studies is that if you really take that minute or that minute and a half, it doesn't have to be a long time, to actually sit and look the patient in the eye and engage with them and listen to what they are telling you, that is so invaluable. And it can really help inform your medical diagnosis, for one thing, because really getting what we call a thorough history and not just jumping to conclusions really helps. And of course, there's the other side, that we're talking about healing, we're talking about feeling well, we're talking about mental health. I mean, you need to have a connection with people, right? So actually sitting and taking in the words someone is saying, actually listening and actively listening, you know, not kind of looking off to the side and typing in an electronic medical record and all these things that are unfortunately necessary evils in our everyday life, currently where we are, but really engaging and listening is huge. And, you know, I think the other themes, the idea of learning, I mean, again, we learn daily. You know, I think anyone who's in clinical practice in the medical world who says that it isn't a constant learning process, they must either be so super wise and learned that, wow, that's phenomenal, or they're probably missing something. Because, you know, we know that the things we know about the human body and the brain, the mind, we know just a tiny, tiny micro amount of what there is to know. So every new patient that we treat, that we see, that we come into contact with, yes, we're trying to help them, but it's also a learning experience for us. You know, that's how we grow as clinicians and as healers. And then I think the love piece, I don't know that I would have chosen quite that word. I think especially working in the pediatric field, it can, you know, come across a little oddly. I guess I would have said something more akin to compassion, right? Which I think is on that same spectrum. So I think bringing compassion to work is just so important, because we all know in our everyday lives, you know, things can be rushed and busy, and we have our own personal struggles, and coming to work, sometimes it is hard to bring compassion. You know, you might be in a certain place where you just want to get through the workday. But to me, it goes with those other two pieces he said, the learning, the listening. It's that sense of taking the extra minute, that sense of being able to meet someone where they're at and coming with a lens that is compassionate, a lens that says, okay, I might not fully understand your struggle or fully understand why you're presenting to the emergency room right now and why this is your chief complaint, but let me try and exercise some compassion, some humanity, and see if by doing so, I can come to an understanding.
Boy, there's such a connection with what you're saying. There's such a connection to the classroom. We would add another word, which is curiosity. When I see a child with, whether it's a mental health issue or a learning challenge that I don't understand or haven't seen before, instead of jumping to conclusions, we challenge teachers to engage with curiosity. I wonder what I have to learn here from this young person. And it sounds like, do you feel like there's a place for that also in ER care?
Oh, 100%, Aletta. I think, you know, if you don't bring curiosity, again, it's that same idea. If you're not learning every day, there's something going wrong in your practice, probably, and not as a blame thing to that individual practitioner, but just, you know, you have to approach it with curiosity. I mean, a lot of us, especially in something like emergency medicine, where we're presented with new patients and different patients throughout a day, we say that a lot of it is puzzle making or puzzle, you know, you're trying to come up with a diagnosis. And so you go into this field because you have compassion, you want to treat, you want to heal, you want to help children. And also because you have that curiosity, that drive to say, what could this be? And what could I do that's novel or different to help this specific child, this specific family unit, whatever that unit looks like, feel better and heal? And with the knowledge, being able to be humble enough and have the curiosity that it might not be a physical thing you do. It might not be the typical healing we think of, sewing up a laceration or putting a broken bone back in place. In many ways, in my field, those are the easy things. And I don't say that lightly. I know it's obviously horribly traumatic. I have little ones myself. You don't want to see your child in physical pain. You don't want to see them with a break, but those are linear. When you talk about healing, you kind of can come in the door, you can make a plan, you can say, okay, this is what we know. We know that if we set the bone back in this way and we put it in a cast for this number of weeks, healing will occur. The harder ones, the intangible ones, are these mental health struggles, because there isn't going to be a quick fix. So I think absolutely bringing curiosity, bringing compassion is what you have to offer when you're not going to be offering an immediate quick fix. They're not going to leave the emergency department with an immediate feeling better plan with a bone that was in 2 parts and is now in 1 part.
Can you say more about that? What does that look like, healing from a mental health crisis? What are ways in which that happens?
I wish I had the perfect answer to that. I think if I did, I think if any of us did, oh my goodness, we would be in so much of a better place. I think the one thing to note is it's so different for everyone, right? And I think that probably comes with the curiosity and compassion piece that even more so, I think, than physical ailments, there is not going to be a one size fits all. This isn't something where you can say, okay, you have this type of bacterial infection. We know from years of research that giving this specific antibiotic at this specific dose is going to, in 92% of cases, eradicate this infection within 5 days. We have, of course, data and research, and we just have amazing practitioners for whom I have so much respect in the field of mental health from various backgrounds. And yes, there are studies to show, okay, if you engage in a course of a certain type of therapy for 6 weeks, or if you, do a medication trial, it's likely going to take 6 weeks, and then you look at effects. But even with that data, it's much less tangible, right? It's much harder to say, okay, we can guarantee quote unquote healing or feeling better in this one specific way. And I think that speaks to the fact that the brain is a fascinating and unknown place. And within brain, I would couch the idea of mind, right? Which is a little different. Brain to me means that can be a physical complaint coming to see me in the emergency room. That can be a child who's had a bad fall and has a concussion, or, even worst case scenario, unfortunately, has ended up with, a bleed in their brain, a more severe brain injury. Mind to me encompasses this idea of mental health. It's how we process, it's how we think, and it's how we feel and emote. And so I realize I'm doing the politician thing and speaking around your question rather than asking it. But, I think healing from mental health, I think it takes time is one thing. I think it's going to be just that realization that it is not going to be that quick fix. I think it takes investment from those around, I'll say the child, even though obviously adult can have mental health concerns, but given what I clinically deal with, it's children or teens. So you need, invested people in your life. And I know we're going to keep coming back to this idea of connection, and I don't want to harp on it, but I think really that's so important to mental health. And it doesn't need to be with the typical mother or father. I have seen many children in my emergency room where that connection is with a valued teacher or counselor, is with a coach, is with a next door neighbor who has just really, taken that child under their wing. And I think for a child who can feel so isolated and alone and confused and not fully know how to process what's happening in the world and what's happening in their own mind, to be able to have a figure in their life, and it doesn't even necessarily need to be an adult. We always say adult. It could be another child. I mean, in general, you're going to be a bit older. Maybe it will be, a teenager for a younger child. But bear in mind, these figures, I mean, I have seen some, and I'm sure you have too, Aletta, in your education work. Sometimes you see 14, 15, 16-year-olds with amazing insight and just ability to connect and emote and be compassionate. And those types of really still children, sometimes they are the one taking the younger child under their wing.
Yeah, absolutely. And you're speaking about connection as not only mental health issue, but also a broad health issue broadly. And I think that's very true. One of the things that is so important in our work focusing on school connection with teachers and school leaders and parents is that this can feel incredibly overwhelming, the mental health crisis, of course, for the young people experiencing it and for those of us trying to support them. And knowing that while connection isn't a panacea, it certainly makes a real difference, can help adults to feel like, all right, I'm not helpless. I can help this young person, even though it's not as straightforward as prescribing an antibiotic or setting a bone. There is something concrete I can do. Do you feel like that is that something that helps you and your colleagues in the ER?
100%. And I think that's in part when you talk about treating a mental health crisis. I mean, one of the primary things we do in an emergency setting is something called a contract for safety. So let's say, you have a child coming in truly with a suicidal ideation, a suicidal plan. Part of the treatment for that to get them back to their home environment is to say, can you give me guarantees that you will stay safe for the next, let's say, look at 48 hours, look at a week. And integral to that is having a reliable, connected person in their life to whom they can go if they feel they are again reaching the crisis point. So in the absence of that, you can't get to the safety point. And as an additional point, I will say, looking back over the pandemic and over what happened to the mental health of our children, we know it was already brewing and bubbling, this mental health crisis prior to COVID and the pandemic, but we really declared the mental health emergency in children during COVID. And I think a lot of that was the lack of connectedness, which from a physical health perspective was necessary. We know that we had to stop the spread and the flow of COVID and we had to isolate, but we also know that being out of school, doing prolonged online learning, that was really, really hard and deleterious to the mental health of all of our children.
And those of us who are adults too, for sure.
Oh, absolutely. Absolutely. Yeah.
So Dr. Coombs, we interviewed you for our recent issue of Hooray for Monday, a free resource that's published once a week that's filled with tips and tools to support excellent teaching. And for that piece, you spoke to the role you see teachers playing in addressing the mental health crisis. You presented 3 ways they can meet students' needs in this arena, and we're going to revisit each of those. But I'm going to ask you to think about the role adults in general can play, because listeners today come from education, but many other fields. So the first thing you mentioned was not to be afraid to talk about mental health, but so many of us are. Can you share a little bit about why we shouldn't be afraid to broach this subject and to broach the subject with young people, and why our fears might be a little bit outdated?
Absolutely. So I think one piece is just the gut reaction that there is still stigma out there. And regardless of, which country you live in and how enlightened you feel or how progressive you are, I don't think we can deny that there is still a different stigma surrounding mental health than physical health. I think when people feel quite comfortable, we can go back to the bacteria and the antibiotics. People will say, oh yeah, my child had pneumonia. They had to be on this course of antibiotics. It was pretty brutal. They were really feeling unwell and then they got side effect of the antibiotics. That's something that's fairly commonly and easily shared. I think it's still a lot harder to say, hey, we were in the emergency room overnight last night because my child felt acutely suicidal. And it's probably way beyond the scope and the time of this segment, but we can go into many reasons why that probably is and why that stigma persists, and the burden that it puts on a parent or a caregiver, that feeling of maybe did I fail, because we do feel it's quote unquote mental. So whereas we see something physical like a pneumonia as unavoidable, that's going to happen, it's just bad luck. I think with mental health, there's this idea of, oh my goodness, what did I do wrong as the caregiver? And then the other piece to that is that for a long time, there's been this idea, well, teenagers, young people, children are young and impressionable. What if we mention something? And what if, God forbid, that puts into their mind something they'd never previously thought of? And so that's one thing where actually the research that's done in the medical field and having data and gathering data has been helpful, because we've shown over and over again that's actually not the case. That there hasn't been a trend where if you ask about or probe into suicidality or mental health issues, that does not provoke these children to then think of actions they wouldn't otherwise thought of. And a lot of places, such as at Children's National, we've implemented that in the emergency room. So we now have a standard suicide screen where we say, over this past period of time, have you been feeling down, depressed? Have you had thoughts of suicide? Have you come up with a specific plan? These are things that a number of years ago we wouldn't have even thought to ask, for the fear that that would have somehow made this child think, oh, I didn't come up with a plan, but should I? Is this a suggestion? What we've shown is that that doesn't happen. And actually, if anything, it's the reverse, that it gives that child a safe space to say, oh, someone's opening the dialogue, someone's asking me about this. Maybe it's valid and maybe it's okay to talk about. So it's creating that space for the child to open up and maybe divulge something they wouldn't previously have told anyone about.
Thank you so much for that incredibly thoughtful response. And we are going to be sharing resources throughout this conversation that will help educators and other adults support children. As you'll see, the resources shared right here just now are activities you can find on Inspired Teaching's website, all linked here, to do with your students to help create that sense of connection, to help build those conversation skills. Because I think part of another reason I certainly see we tend to be afraid to talk about mental health is because maybe we haven't practiced enough with our students or with the young people in our lives, just talking about things that matter. Yes, we can about the novel we're reading and the historical events we're studying and the scientific concepts, and those things very much matter, but also how am I feeling? And I'm feeling really frustrated, or I'm feeling worried, or I'm feeling delighted. This activity, the emotion continuum that's featured here, is one of the activities that just helps young children and not so young children build a vocabulary to talk about the really important things going on in our lives. So we encourage all of our listeners today to check out these resources and use them in your classrooms, in your homes, anywhere you interact with young people. Dr. Coombs, I want to ask you, so the second thing you recommended when we spoke on Hooray for Monday, you recommended reaching out to others, reminding us that no adult has to do this alone, because sometimes, especially as teachers, we feel we are overwhelmed, and now on top of everything else, we're not trained, most of us are not trained mental health professionals, so we can feel very alone. So if someone knows a child in crisis or is engaging with a community of young people in which some may need help, where can they go?
Yeah, it's a great question. And I completely feel that as an educator, or as we said, wanting to make this more broad, just as an adult who might be an important person in a child's life, even if that's really just your next door neighbor, let's say you build that bond, let's say you build that connection, let's say you get that child to open up to you, and then you feel stuck because you don't know where to go. So I think remembering that there are resources out there. So one, we in the pediatric medical field often go back to the American Academy of Pediatrics, and I think we're going to have a slide or link some of those. So, the AAP is our governing body within pediatric medicine, and they do have a number of resources, tip sheets, publications and material that's out there to help navigate you through a child having a mental health crisis. That's one big picture, very removed resource. I would say the other thing, if you are someone who connects with children in your community in a meaningful way, the other thing is maybe take a minute, and it could just be a search online. Take a minute to look around and see what's available in your community. And I say this as someone who fully knows that, often mental health resources are scarce, are hard to come by. There are often really long waiting lists, but, you might be surprised that there is a crisis center, or there are even telemedicine services that offer virtual counseling sessions for free, or for reduced fees, or for something that's affordable to the child. There are still, national suicide hotlines. So I think just having in your back pocket, if you're an educator or someone who engages with children in this way, a few resources so that you don't feel powerless if you are in a position where a child has opened up to you.
Thank you. That's really important. And finally, when we spoke with you, you spoke about the power of simply being a positive presence in the lives of young people. What does that look like?
So just like everyone has different mental health crises, I think that can look different, right? So, it can be, we think often of the idea of role model. I don't know that I love that terminology because I think it's a bit laden and it kind of comes with pressure. To me, it implies that you as the adult or the older positive presence, even if that's an older teenager, has to be sort of perfect or somehow, literally you're modeling, you're showing everything that's good. I would almost flip that on its head and say, show your imperfections. I think the idea to a young person, to a child, that adults also have struggles, that adults also have questions, that not everything is perfect or linear. You just showed that wonderful, kind of emotion expression banner. I mean, how many adults could probably do with a banner like that in their lives, right? We, in some ways, yes, I look at my own toddler and I can sometimes see that building frustration and anger and not knowing how to express it. And I think we think of that typically with toddlers of, oh, they're so young, they're pre-verbal, they don't understand how to express it. Sometimes their expression is better than ours, right? Because they're more pure and they'll just put it out there. Whereas the more we go through society and adulthood and, as we have this phrase, adulting, we learn to suppress those things. We learn those things aren't okay and they aren't accepted and they aren't socially acceptable. So I think, being a good role model, you obviously do want to show strong behaviors and coping behaviors, but also don't be afraid to show your vulnerabilities. I think having a child who can see that and see that there are struggles that someone they admire and look up to has overcome for him or her or themselves can be so impactful and powerful, and can maybe give that child who's really struggling at that point a glimmer of hope that there is another side to that struggle.
I really appreciate that point. One of the things we've learned in our work as teachers and with teachers is not only to share struggles you've overcome, but to share struggles you're still working on. And to be able to say, I really, I spoke to a colleague in a way that I wasn't really proud of myself, and I need to figure out what I'm going to do. I haven't quite decided yet, but I'm going to have to go back and make amends. I need to figure that out. Can be really powerful, right? Because not everything is perfectly solved, and that.
Oh, right. And you don't want to portray
person.
that image that it is,
Right.
and everything is
Right.
perfect, because I think that's destructive. And we know that, that also goes back to the connection and the idea of social media. That could also be a whole other segment, but there's that idea that perfection is propagated on social media, and that's harmful to adults and children alike. And I think the idea of making the personal, real connection, things aren't perfect. They're just not. It's not the state of life. It's not the state of any human being that at least I know. And having that realness out there can just be so helpful.
Yeah, authenticity for sure. Very,
Yeah,
very
exactly.
very important. So thank you so much. There are for our listeners today, there are even more resources which you'll see coming up right here on the screen, and you'll be able to reach to connect with them after the presentation as well. This is a tool we created at Inspired Teaching quite some time ago, but and continue to update because it is of such value to learners of all ages, including adults, based on the work of psychologist William Glasser. It's called the ABCDE of learner needs. And a very brief description is that it is, if you see, I'm thinking of Dr. Coombs' toddler or a teenager or an adult behaving in a way that we wish they wouldn't behave, instead of thinking, well, how do I discipline this person, or how do I impose a consequence? How do I get the behavior to stop? Though, of course, we may need the behavior to stop. We challenge ourselves as adults to think, might this behavior be an expression of an unmet need? And how can I help this young person or not so young person meet this need? And we've created this ABCDE shorthand of needs. Autonomy, I want to have a say in what happens to me. Belonging, I want to feel connected and valued to those around me, which of course is what we've been talking about here in school connectedness. Competence, I want to feel a sense of significance, worth, and accomplishment. I want to feel like I can do it, like I'm smart. Developmental appropriateness, I'm nurtured in my continual growth. I'm doing things that are challenging enough, but not so challenging that my sense of competence is threatened. And engagement and fun, I want to be actively involved. So this is a tool that can help us as teachers and healthcare providers and parents and all sorts of people who work with young people to look at and meet or strive to meet the needs of the young people in our care. And we have some other tools as well. Our Hooray for Monday weekly publication for teachers, school leaders, and really anybody who wants to be a positive presence in the life of young people. Please sign up for that. Our Hooray for 2023 calendar has a monthly resources every month, new things for you to help in your work to connect with young people. And if you happen to be a teacher, a pre-K to 12 teacher in Washington, D.C., you can sign up for our Teaching with Improvisation Fellowship. Much more information about that on our website as well. So, Dr. Coombs, thank you so much for joining us today and sharing these insights. We really appreciate. We have one more to share, this a terrific article that just came out this month in the May issue of Kaplan Magazine that I wrote on how to make learning for teachers engaging and meaningful and respectful, building on improvisation-based learning, which is at the core of all we do here at Inspired Teaching. Among other things, it promotes relationship building and connectedness for teachers. And that's a very important thing for us as adults, it turns out, not just for young people. So thank you. You can check out our Hooray for Monday posts on school connectedness as well. They will be shared at the end. And join us again this evening if you want for another session on school connectedness and more resources and further discussion with Dr. Tanji Millard, a high school principal in Alexandria, Virginia, who is doing some really important work on this topic as well. Visit inspiredteaching.org for tools to help you create classrooms in which you and your students can thrive. Thank you again, Dr. Coombs. It was so lovely spending this time with you. Thanks to all our listeners today and for all that you do to support and connect with the young people in your lives.